If you have sciatica and are considering wearing a back brace or a SI joint belt, then this video is going to be exactly for you. There are many different back braces on the market and it can get confusing, especially when you're in pain. Lots of advice out there, so I'm here to dispel some of the myths and try and show you exactly which brace is going to be the best for you. I'm Dr. Jeremy Andrews, Doctor of Chiropractic here at West Chiropractic in Surrey. So what is sciatica? Well, sciatica, firstly, it's a symptom. We need to remember it's not the cause of the pain going down your leg. So the most common cause of sciatica is going to be a herniated or prolapsed disc. So if I show you on here very quickly, this is a model of the spine, a segment in the base of your spine here. So these are the knobbly bits you feel on your back. The yellow bit is the spinal cord. When the nerves coming out the side, those are the nerves that go down your legs. The red bit here, this is the disc. So what can often happen is if the disc is compressed, so too much sitting, postural issues or traumas, over time, years, the disc can then come out like this and it can start to put pressure onto the nerve. So if you can see that there, it's putting pressure onto the nerve there. Now that's going to cause a referred pain down the leg. You see good? And then this pops out, presses on the nerve, it dislodges the nerve. That's going to cause a lot of problems with sciatic pain. Now, sciatica is characterized as shooting pain, pins and needles, numbness, tingling down one leg or both legs. More commonly one leg as the disc goes out to the side. If it's both legs, this can sometimes come out the back and that's more of an issue. So very often we see people coming in a lot of pain, debilitated, a lot of pain going on their leg, they can't sleep, they can't move, they can't find a comfortable position. So if that sounds like you, we need to try and get you out of pain as quick as possible. So what do we do? Well, the GP is going to recommend taking some strong painkillers. You may be on things like naproxen, Oromorph, amitriptyline, gabapentin, which is fine, but we don't want to be on those for long term because they can cause detrimental effects to the rest of our body, our guts, and they're never designed for long-term use. So we need to try and get you out of pain as quickly as possible, as naturally as possible. So chiropractic care, physiotherapy, osteopathy can take pressure off the nerve, but sometimes it can take a little bit of time to reduce that inflammation. The disc, because it's got such a poor blood supply, will take a number of months to fully heal. Doesn't mean you're in pain for a number of months, it just takes a long time to actually heal. So what I want to show you today is some of the things that you can try at home, which is a back brace or an SI belt, in order to help you get pressure off your back, to support the spine and allow you to get those symptoms down and under control, get back to your day-to-day living, working, moving, looking after your kids, and then sleeping better as well. Okay, so let's go through it. So what is this? Well, this is a back brace. Okay, so very, very simple one here, nice and easy. I'm going to talk to you about 3 different types of back braces today. What happens on these? Well, let me show you. The back brace is like this, all right? It's got a nice big bit on the center here. So what you want to do is you want to get the back brace as low down as you can to give as much support. So I'm putting this just on my belt line here, just above the top of my buttocks. And what we do is we try and get both sides and pull them as hard as we can. So you should feel a bit of a pull into your back. When I'm pulling like this, you should feel my back come in a little bit like that. Now just be careful, if you're in pain, you don't want to put too much extension into your back. So what we do is we then wrap this around like this, and it should be pretty snug. Okay, I'm just gonna put it a little bit tighter. It should be nice and snug like this. So what you want to do beforehand is just measure your waist, just to make sure that you're getting the right measurement around your waist for which size that you're going to be ordering. Okay, I'm filming this at Easter time, so I've had a few Easter eggs over the weekend, so maybe a little bit tight. Now, this one is great because it's got 2 straps that you can then take off and pull round to increase the tension through your back. I'll take this one off as well. This is all Velcro. Velcro is great because obviously it's adjustable. So I put one just up on here. I pull, so you can pull into it like this, really tight, and have another one down like that. Okay, so you can see that. See the Velcro coming across here, that's around my back, in this area here. It's gonna take a lot of stress off my spine. So how does this work? Well, there's a muscle that runs all the way underneath your abdominals. And it's called the transverse abdominis. And it's exactly the same shape as this brace here. So what it does is essentially provides a lot of stability into the vertebrae in your spine, gives a lot of stability to the joints in that area, and allows the disc to essentially stay more stable. So when we've got tension on this area here, it's contracting our abdominals, it's causing the pressure to come off the disc and allow that to then be functioning much better. Now, problems with these, if we start to use this too much, then the body's going to use it as more of a crutch. Now, we don't want that. You want to develop that tone in your core. You want to have the transverse abdominis working well. You want to have the abs working well, your obliques, then taking pressure off the core long term. So only use this is very, very important. Only use the brace when you're in severe pain. So if you're waking up in the morning, you need to use this to get out of bed, strap the back up, getting up and down the stairs, getting in and out of the car. Really, really good to use these. If you want to go out for a walk, get this on and treat it as a crutch. You know, a crutch that you use when you've damaged your knee. You're not going to use that forever. It's just to allow you to move around, put some weight on the back, but without causing too much pain. Don't get over-reliant on this. Now, you want to use this probably for the first 1 to 2 weeks of your recovery. After 2 weeks, you've then got to start using it much more sparingly. As I say, only for those activities where you're having to lift something, having to get in and out of the car, having to walk around, very, very sparingly. So do not use it when you're sitting, do not use it when you're sleeping. Okay, we need to make sure we're letting the pressure off, allowing those muscles to regain their composure again. So nice and tight, don't use it the whole time. 2 to 4 weeks, use it sparingly. After 4 weeks, you really shouldn't be using it too much. Okay, if you're still using it around 4 weeks, then you probably need to seek some professional help to ensure that we're trying to get pressure off the disc in a different way. Second kind of brace is called an SI joint belt. So this one's quite a fat one. This is a normal back brace. So an SI belt is going to be thinner and it goes much further down. So it goes down around the buttocks and it's really intended to really pull the SI joints together. So if you look here, these are my 2 SI joints that I have here. When I walk, they should move like this, okay? Now, the SI joint belt is very common in pregnant women, purely because of the instability that goes through their SI joints, particularly in the 3rd trimester after the body releases something called relaxin. So we need to try and get those SI joints as secure as possible, helps the pelvis to not move as much, allows the body to then function. You can move around, especially when going through pregnancy with the baby growing and obviously the uterus growing. We need to make sure you're still mobile, you're still moving because it gets blood flow through the body, but also you want to make sure that it's not too painful when you're doing it. So do I use an SI joint belt for sciatica? Not really. We do treat a lot of pregnant women here that do develop sciatica in the 2nd and 3rd trimester, then we would recommend an SI joint belt. But if you're not pregnant, we probably wouldn't. We probably start with a normal back brace. That's going to give you much more relief and it's going to secure those lower lumbar discs, okay? And then the 3rd type of belt is a decompression belt. So very similar to the standard back brace here. The decompression belt, it has a pump in it. So you wrap it around the same area as the back brace and then it pumps up. Now the idea is it's trying to decompress the lumbar vertebra to open up the space to allow the disc to come back in. So it essentially lifts the thoracic up, it brings your rib cage back. It probably feels like your lungs are getting a bit compressed, but it's ultimately trying to take as much pressure off the base of your spine. I like them. I think they're expensive for what they are. I think you can get a similar result from a back brace, but it's purely up to you. If you've got a friend or a family member that has one, then maybe give it a go. If you like it, then invest in one. But I would say start with the normal standard back brace that I showed you in step 1, and then maybe work your way up to the decompression one if you're finding that you're getting some relief from it. Okay, so thank you so much for watching. If you are struggling with sciatica or you know someone struggling with sciatica, please share this video with them, hit the like button and subscribe to the channel. And you can grab copies of my best-selling books here in the show notes below. Chance on me back, Secret Cure to Back Pain, How to Avoid a Lifetime of Painkillers and Surgery on Amazon now. All right, thank you so much.